What a pleasant way to welcome you this morning to another splendid edition of the KMTV Morning Show. I am humbled to be here. There are lots of things we are to talk about this morning, confronting our society and managing to derive strategies and suggestions to solve some of those ones. It is upon us as young people and journalists to always point out lapses in government, hoping that they can listen to us and follow the right trajectory in making Liberia a better place for all of us. My name is AMOS Thomas Momo. Today is the 26th of August, 2021. And I'm humbled to be here this morning. On to this presentation to give you the lineup. We will be talking health-related issues. We will have the former Director General of the National Public Health Institute and a Liberian scientist in person of Dr. Mosoka Fallah. He will be our guest this morning, and we'll talk health-related issues. We'll look at, in particularly, the vaccine. Okay, he's saying now we're good to go. We'll shortly join. We'll look at the vaccine, the administering of the vaccine, those side effects. We'll be looking at challenges involved. As you are aware, excuse me, as you are aware, the country was having it difficult in having additional vaccine to commensurate with the many challenges citizens were faced with in getting vaccinated. We'll be looking at the new vaccine or supplies of vaccine that was brought into the country, taking into consideration Dr. Mosoka Fallah was one of those individuals who was calling on the international community, making sure that new supply of vaccine can be brought to the country and citizens can get vaccinated. There were too many challenges. During the time, the vaccine was not, sufficient to, I'm getting a feedback from Dr. Mosoka Fallah, so probably you could just mute him until we can get ready to join. So during that time, citizens were finding it very, very difficult to get vaccinated because when you get to a health facility, they will tell you that, well, for example, I went to do my vaccine, the first dose, and I think you should do 2 doses. And the first dose, they were reserved a particular vaccine or the second dose for me. So an individual who having, been given the first dose and went to that health facility, my dose that is there, they will say, well, the person that did their first dose, this dose is meant for them so that they can do the second dose. But now, I think it is the other way around. So Dr. Mosoka Fallah will be giving us a clear picture on whether you do the first dose, you can also wait and do the second dose of another vaccine. I think that's what he said. So we'll be talking about it as well, and we'll be talking about other issues surrounding health-related. We'll look at the National Public Health Institute functions. He was there as Director General, though he's not there, but he knows how they should work. We'll be looking at that. We'll be looking at the Ministry of Health functions as well as we go on our discussion this morning. And I'm humbled. On yesterday, this week has been for our CEO. He celebrated his birthday on yesterday, the 25th of August, 2021. And this entire week is dedicated to our CEO in person of CEO Ranulph P. Jackson. I want to say happy birthday week and happy belated birthday. Hoping you had a wonderful celebration with your family, your workers on yesterday. I think yesterday was one of the days that I left you up to 6 o'clock. Can you imagine that? Though we're not having too much fun time, but we're having a good time with our CEO and making sure that he can feel alive and as he go about celebrating his birthday on yesterday. So I'm humble. My name is AMOS Thomas Momo. Lots of things happening. We'll dive into politics, but not today. Today we'll talk health-related issues and other health practitioners are glued to their phones to ask those sensitive questions. And other citizens are also glued to their phones to ask those doubting questions, those questions that will have them encouraged to take the vaccine. Dr. Mosoka Fallah a Liberian scientist and former Director General of the Liberian National Public Health Institute, is our guest this morning, and we will join him very, very shortly. Whatever you are encouraged to share this live podcast as we go about discussing those issues that matters. It matters because it is about your health. Someone say health is wealth, and I'm humble this morning to have a Liberian scientist as our guest. Dr. Fallah, are you there?
I'm there, Samo. Thank you so much. I'm here.
How is it going on with you there out of Liberia?
Yeah, it's going great. Lots of work. Yesterday was a good day. Our group has been advocating for the West Africa Health Organization yesterday. We're about 15 persons from around the world to collaborate with them. So we can see the issue of the vaccine. Africa at the coming World Health Assembly. That meeting went very well with a small reverse that we initially wrote. And our goal is this kind of working with WAHU so that there can be more vaccine provided for Africa. The good news is that there are now plans on the way, aggressive plan on the way to start manufacturing vaccines, COVID vaccine in Africa. Aspen in South Africa has begun manufacturing the vaccine, which is the good news, except that most of it was sent to other countries outside of Africa. We're happy to know that Nigeria is a good candidate for the manufacturing of the vaccine.
Okay.
The Pasteur Institute in Senegal is accelerating processes to begin manufacturing the vaccines. So Ghana. So we're happy that at least we are going to have full sites across the continent manufacturing vaccines. So it's going to take a year, but it's a good news. And the fact that South Africa has now begun manufacturing of the vaccine. So you always one of the time when you work for months in the background, and you have a very good community experience. Welcome our idea and our initiative, and we are going to engage with them. That Africa has access to vaccines. Yeah.
Thank you so much for joining us this morning. This place is not strange to you. I think this is your second appearance, and we are humbled to have you joining us. Before we get into the vaccine stuff, I want you to tell us a little bit about this Refuge Place International that you are a part of. There are lots of things they are involved with, making contribution, giving back to society. Tell us a little bit about this organization.
Yeah, so I think in 2010, when I was a student in the US, I lost a close relative of mine, and I wanted to give back to where I grew up in Chicken Soup Factory. And so in the US, with a few of my American friends, we started an NGO, and my goal was to build clinics across the country where poor people can afford care. And so a few of my friends struggled. And so we built our first clinic. We built a second clinic in 2017. Now we're building 4 more clinics. And so we continue. We have a board in the US and we have people in Liberia working. We decided to get involved with the COVID response by response from our friends. And so we help with getting material for the star base and hospitals. Now we are involved in prevention, setting up hand washing bucket, producing and distributing free face masks. We think that at this stage it's a time to help the government to complement the effort of the government in helping to call the spread of the disease.
All right. Thank you so much. Now, the issue of the vaccine, majority of Liberians have started to forget some of the preventive health protocols. What's your fear as it stands? Looking at Liberians now have started, forgetting about wearing nose masks. They have started to forget about washing their hands, started to observe social distancing. What's your own fear? Do you think we are at a point to forget so soon? Dr. Fallah, are you there?
We have just in July, we saw since all the yeah, I'm here.
Okay.
Just in the month of can you hear? In the month of June and July, we saw us after we went quiet by April and March, and then there was a time we started. We saw that there were more cases, people died, people got infected. And from all this, what was shown responsible for the third wave was that people relaxed. People quickly relaxed the public health measure. And so that what happened to us. We begin the contest 19 cases in West Africa. In fact, I did a calculation where I was compared to early February, March, our cases increased by 250%. Our death rate increased by 74%. Just in 6 weeks. And one of the major factors was to relax our preventive measure. So there's no way you can relax the preventive measure because again, other countries have started experiencing the fourth wave. So this is for the long haul. We got to be able to sustain this protection until we can vaccinate percent. So it's a dangerous thing to forget this early. It is very dangerous to forget and relax because the same that we went through the pain we went through where all the Facebook, social media were inundated with rest in peace and rest in peace. People lost relatives. We should not forget that. Because by the time we forget that COVID, we just make it difficult and make it honorable that could because it's
I would want us to have a very, very interesting conversation,
hello?
but you are coming in that well, actually. We hoping that the device you're using, you can turn it off and put it on again and rejoin to see how best it will work up for you, I mean for us, because the information is very,
Let me
very
try that
important.
again.
Yeah, the information is important, and we really want us have this very important conversation. So maybe you can turn the device up, I mean off, and put it on again, so we know exactly where we are. We have Dr. Mosoka P. Fallah as our guest this morning, the former Director General, National Public Health Institute of Liberia, a visiting scientist at the Harvard School of Public Health. He's our guest this morning. He's a Liberian scientist, and he's here this morning to talk health-related issues, and we will be looking at that as he come back on the show. But there are other things to talk about this morning. The LFA have this issue, and I think the authority of the Sport Association of Liberia is working on it. The Samuel Kando Sports Complex was not approved by CAF for FIFA World Cup qualifier, quarter qualifier 2022. So it means that with all of the jobs that were done at the Samuel Kando Sport Complex, yet them stay CAF is yet to approve the complex for the quarter qualifier of the 2022 FIFA World Cup. And so I think they need to double up and do more, because the CAF will need that stadium up to date. They will need to have a very, very up to this stadium, because teams will be coming from various countries, not only Liberia and other African countries. Liberia will be the host, so they need to do more than what they are doing. They have to double it up. And so this country is about us as young people to talk about those issues that matters, like the fire incidents in Kakata. Citizens, young people in Kakata, headed by my big brother Thor. They are raising funds, calling to them, calling to us because we all hail from Kakata, Magibi County, and so we are managing. We are managing to raise funds to see how best we can buy one fire service truck, and that is very, very welcoming. We're hoping that other authorities who are in Kakata, lawmakers, can rally around us and help to see our dreams come through. And so for those of you who are not part of that chat room, you can get in. It's a serious, serious setback to citizens of Magibi County. The only referral hospital, government referral hospital, got burned to ashes. And our citizens out there, they need health attention, they need medical attention. And the only way, those that cannot afford, they will have to go to government hospital. And that was the only hospital that was returning to millions of our citizens. So we are still here waiting on Dr. Fallah if he comes on, hoping that the network will do us justice. And if that happens, then we will go about talking about those health-related issues that matters. So wherever you are, whatever think you are doing this morning, I want to say thanks so much for joining us. And we're hoping that we can have this very, very friendly conversation with Dr. Mosoka P. Fallah, the former Director General of the National Public Health Institute of Liberia. Is he there? Rounds 4. If he's there, then you bring him on, and then we will start to talk about those ones. Dr. Fallah, are you there?
I'm here, sir.
Okay, I think it just came to my mind that you switch it off and put it on. So it's much better. Now, do you think, as we start up resume, do you think Liberia is at a point, looking at the look of things, cases, the emergence of cases, someone will say is decreasing. Do you think with the decreasing of cases, Liberia is at a point to have citizens going about doing their normal businesses?
I mean, gradually, the more the cases are going down, the more we can start to gradually relax. The history of the disease have for 3 weeks. No way you can relax the pressure 100%. You have to it has to be a gradual relax. Imagine China that had the first case, relaxed, went back. The US, the UK, Australia. There are too many evidences that shows that you cannot do 100% relax. It has to be a gradual relax, and the measure has to be consistent. Yeah, it has to be. Because if you relax and the public gets fatigued, again, we can quickly go back to where we came from.
Okay. All right. So when you think as a scientist and a health practitioner, when you think in a country that is affected of COVID be pronounced free, when you have 0 cases or a particular maybe 1 or 2 cases, then you can be pronounced free?
For a pandemic, it will be extremely difficult to